Artificial Intelligence Doctor, www.abcpharma.net/English. User question: what are the physiological mechanisms underlying the symptoms experienced by patients with no atrial pacing, and how do these mechanisms vary among different patient populations? GPT-4o answer: the physiological mechanisms underlying the symptoms experienced by patients with no atrial pacing are primarily related to the loss of coordinated atrial contraction, which normally contributes to optimal ventricular filling and overall cardiac function. When atrial pacing is absent, several key mechanisms can lead to symptoms. ####1. Reduced atrial contribution to ventricular filling, atrial kick loss. Mechanism ** the atrial kick, which contributes to ventricular filling during diastole, is lost in the absence of atrial pacing. This reduction in ventricular preload can lead to decreased cardiac output, especially in patients with stiff ventricles or diastolic dysfunction. Symptoms * patients may experience fatigue, dizziness, and exercise intolerance due to the reduced cardiac output. ####2. Atrioventricular desynchrony *. Mechanism * without atrial pacing, there may be a loss of synchrony between atrial and ventricular contractions. This can result in inefficient cardiac function, further reducing cardiac output. Symptoms * palpitations, shortness of breath, and syncope may occur as the heart struggles to maintain effective circulation. ####3. Increased risk of atrial fibrillation and arrhythmias *. Mechanism * the absence of regular atrial contractions can predispose patients to atrial fibrillation, AF, or other arrhythmias, which can exacerbate symptoms and complicate the clinical picture. Symptoms * patients might experience irregular heartbeats, increased fatigue, and episodes of lightheadedness or syncope due to the erratic heart rhythm. ####4. Ventricular rate irregularities *. Mechanism * the loss of atrial pacing can lead to variability in the ventricular rate, particularly in the presence of atrioventricular block or intrinsic conduction system disease. This can lead to hemodynamic instability. Symptoms * fluctuations in heart rate can cause episodes of dizziness, hypotension, or even heart failure symptoms in severe cases. ###5. Autonomic nervous system imbalance *. Mechanism * the absence of atrial pacing can disrupt the balance between the sympathetic and parasympathetic nervous systems, which may affect heart rate and blood pressure regulation. Symptoms * this imbalance can contribute to symptoms such as palpitations, anxiety, and changes in blood pressure, exacerbating the overall clinical condition. #### variability among different patient populations. Age * older patients may have less compensatory capacity, leading to more pronounced symptoms, especially in those with pre-existing cardiovascular disease or diastolic dysfunction. Underlying cardiac conditions * patients with heart failure, hypertension, or structural heart disease may experience more severe symptoms due to the additive effects of atrial dysfunction on their already compromised cardiovascular system. Comorbidities * the presence of comorbid conditions such as diabetes, chronic kidney disease, or pulmonary hypertension can exacerbate the impact of no atrial pacing, leading to more severe symptoms and a greater decline in quality of life. Lifestyle factors * patients with a sedentary lifestyle may tolerate the absence of atrial pacing better than those who are physically active, as their overall cardiac demand is lower. However, active patients may experience a more significant impact on their quality of life. Understanding these mechanisms and their variability is crucial for developing individualized treatment strategies that can help mitigate symptoms and improve the quality of life for patients with no atrial pacing.